Welcome to Equality, Diversity, Inclusion, Health Psychology podcast. This is going to be a very fantastic conversation we're going to have over the set of kind of episodes that's going to depict what this means. I don't know what it means. I'm joined by my co-host and some guests. So a bit more introduce about myself. I basically teach a lecture at a higher education setting, teaching the role of psychology. My background is health psychology. My name is Jolel. You might see me around, but if you want to know more about me, I'll put some more information in the bio. I'm going to hand over to my co-host, Jan.
Hello everyone. Welcome to this particular podcast, and thank you, Joel, for that introduction. It's nice to see everyone today is attending, and thank you very much for listening in. My name is Jan. I have a passionate interest in psychology, particularly health psychology, but I'm also really passionate and interested in equality, diversity, inclusion. So I'm extremely excited to be here today. I also, my day job, I obviously represent a higher educational institute at university, and I do some teaching sometimes on equality, diversity, inclusion and health psychology. So I'm going to pass this on to Kiran.
Hi, I'm hello everyone. I am Kiran. I am a practitioner health psychologist. I work with people in the NHS with sickle cell disease, and I also have my own projects around health and community psychology, to reach underserved groups. And I've been doing work around equality, diversity, and inclusion for several years now. So now I'm going to pass to Lucie.
Hi, I'm Lucie Byrne-Davis, and I'm also a health psychologist, and I am a professor of health psychology at a higher education institution as well, and I have some roles in teaching around behavioural and social sciences for undergraduate doctors, and my equality, diversity, inclusion journey is quite short in its sort of in how much I understand, and I'm very much a learner at the moment. I'm trying to learn more and trying to be accountable in my own life in that way, and so I'm just really pleased to be here chatting about it today.
Thank you, everyone. Yes, I think what we'll do, we'll start off by discussing what we're here to do on this first episode. For those people like me listening, thinking, where do we come from? What kind of areas do we represent? There's a reason why we're not mentioning any particular type of organizations, because we are doing this independently, and we're basically representing ourselves and our views. And I think sometimes one of the first questions I wanted to talk about is the benefits of that. I don't know what you guys think about because I think when you have certain kind of conditions under us, sometimes it can suppress information, ideas, solutions. But when it's independent, we have more open and free thinking without any pressure. Just wanted to get your few thoughts before we go into the main question. What are the advantages of that, Jan? Jan, what do you think?
Yeah, I think there's something to be said about independent and perhaps free speech by having that kind of opportunity. And I think certainly with my understanding of equality, diversity, inclusion is that element of freedom, of celebration of different views. And I think perhaps having that independent pathway could be one way of accessing that, representing that.
My perspective, when I think about representing an organisation, being something, there's sometimes no space for ignorance and vulnerability within that. It's difficult to kind of say, actually, I don't know what I'm doing, or or even I do know what I'm doing in case it's wrong, or and I think being vulnerable is really important. So showing that you're at a stage of learning, and that's okay, but that isn't necessarily okay if you are representing an organisation. So I think for me that's really important part of what we're doing today.
I think for me it's important because it allows me to take a step back out of my context that I work in, and to bring some things from what I do as a practitioner, a psychologist, but also some elements of myself as a person. And that sometimes that can be a bit left behind, and we can get very much into our heads about this kind of stuff. Actually, there's also that very much how we feel about certain things, and that wholeness that we bring. And I think this gives us an opportunity to do that.
Maybe that's something to be said about, we've all got a universal experience here, and that we're all being just openly saying that we're independent from our organisations, and maybe there's a universal experience amongst the four of us here today, maybe.
Yeah, I just think that when we're teaching, like especially when we're sharing knowledge with information, we're asking people to be independent with their thinking, so, especially high critical forms of thinking, so we can identify solutions, we can collaborate. And I think this is one of the major issues why we have such inequalities, because we have the solutions, but there can be pressures on us or barriers on us to help us solve those problems or to work together. Now I'm just going to bring on to the main question then. So, this question is around, what do we mean by equality, diversity, inclusion? Such a broad term, three massive concepts. People out there are trying to basically find out, I think, what does it mean? How do we tackle it? Are we talking about the same thing? Because you can see there's such big appetite for change in terms of cultural behaviors in organizations and in today's society. So what do we mean in the context of health psychology? Because that's our area. So what do we mean by that? And I just think that question might be useful for the people listening in to say, okay, how do we mean all the same thing, and how do we have this discussion? So who wants to start us off? I don't know if Jan, you want me to go first?
Yeah, I think the concepts of equality, diversity, inclusion are related. I think they are sometimes interchangeable, but for me, looking at equality, where the emphasis is there is having some equal access to opportunities. You mentioned inequalities there, Jolel, and I think certainly reflecting on my personal experiences and professional experiences, sometimes we are supporting or working amongst people from particular backgrounds who may have encountered some particular disadvantage or some level of inequalities. And I think recognising equality is trying to ensure that people have the same level of opportunities regardless of their background. I also think equality is also linked to it has a legal context, and it's important, I think, within psychology to embed that perspective in terms of protected characteristics which are legally protected, so areas around race, gender, etc. Your thoughts?
Kiran, what do you think? Deep in thought there.
Yeah, I mean, sometimes I get torn between the concepts of equality and equity. It's like, sometimes people think equality means all the same. It's not. It's we might need different things to increase that representation, but then we have equity, and I wonder, sometimes I get a bit lost between the kind of adjustments that we might make to make what we do more equitable, like, for example, the research questions and participants that we have and where we draw them from, and the where we work in practice settings with client groups, and not just the client groups that we see, but the ones that we don't see. So that's the kind of that's where the tension lies for me. But then the diversity is having at the very least a population that's representative of the wider population according to ONS, for example. That's the minimum of what that means for me. But it might be also diversity with perspectives and research, ideas and theories and models, and inclusion. It's probably the easiest in some ways, because it's about having people have a seat at the table. But at the same time, if we include people, but then we don't have any systemic change, in the institutions that they go into, then we might end up losing those people because we've not done anything to accommodate them or to, enable their meaningful inclusion.
Yeah, that systemic change thing, I think, is the big thing for me. That when we have a group of people, like, so in our case, it's like a health psychology community, if you like, people who are working in that field. We kind of say, this is what our group's like, and you've got to be like us to be in our group. And that is what needs dismantling, I suppose. And that's what I think is the key thing, is critically saying, why is it like that? How is it unfair and inequitable that it's like that? Who are we excluding because it's like that? And how, what I guess, brilliance of diversity are we missing because it's like that? And groups are open and closed, aren't they, to different people on because of loads of different things. And I think if you're in a situation where you are just naturally included in some groups, you never particularly notice, unless we make it really obvious, unless we, and I think that's what, when I said earlier on that I'm at the beginning of my journey, I think I've not really noticed very much about groups that I'm automatically included in, but I've noticed when I'm excluded from groups. But yeah, and it's that kind of, how can we be so open to the stuff that affects us badly and not open to the stuff that's affecting other people badly? And so it's that for me is what we mean by EDI and activity, I suppose, as well, rather than anything else. It's actually, what can we all do tomorrow that makes that situation better than it was today?
Just on that, before we move on, I just wanted to kind of reflect something that I was thinking about today, is that for years, I think health psychology and health psychologists, we felt frustrated because we didn't get a seat at the table in wider organizations and strategies, and we didn't feel valued. And I think that's, it's very easy for us to see that on the outside looking in, what we value, and also see that maybe what we contribute isn't valued. I think certainly felt as a minoritized psychologist on a few different axes, like, some of what we contribute where we are marginalized isn't seen sometimes within the mainstream, if you like, of the main body of health psychology, and that's difficult. It's difficult to be on the outside in that sense.
It's an interesting thought, isn't it? I think the concept for inclusion for me is thinking about being compassionate, and regardless of people's backgrounds, thinking about elements of tolerance, acceptance, regardless of people from particular social groups, and really respecting different perspectives and viewpoints and social groups, and actually just having that kind of that openness and that willingness to learn from different groups that you might not potentially belong to. And perhaps also recognizing that people will have different views and opinions, and that's okay to have different views or experiences. But I think we talked about invisible aspects and things which are not known. I think within this ethos of EDI, I think there needs to be that openness, that people are willing to talk about their experiences, so we can find out exactly if we are missing out particular key groups. Finding out a bit more about that.
Yeah,
I think we also need to be prepared to do the work, though. Sometimes, I think the difficulty that we, encompasses, like, we want to be able to make it clear that people can have their voices heard, but we don't want to put the onus on minoritized groups to educate us, So it's, meeting people in that way and enabling that safety, but at the same time, not expecting them to carry us, if you like, if that makes sense.
Yeah, I think there's a danger there of perhaps EDI becoming a tokenistic type exercise, or something that is tick box exercise, rather than something that which I feel should be embedded throughout psychology and health psychology generally. So perhaps having that commitment, but you mentioned resources there, but I think also allowing some capacity or resources to incorporate EDI or space to bring it in to start to discuss across health psychology and psychology more generally. Lucie, sorry, I interrupted you.
Yeah, no, I was just about to say exactly that, really, that it is important that it isn't, so I find that balance difficult. So that it's challenging that sort of, you know, acting for people rather than acting instead of them, or rather than, you know, and where that balance is to do the work yourself, but not pretend that you know something about stuff that you don't know anything about. And so I think that balance is really interesting, and that brings us back to that first thing about speaking in a personal capacity and being able to say, I actually don't know what to do about that, finding that very challenging, and being open about having that conversation where it's two-way, and where people are able to say, well, it's fine if you do this, but I don't want you to do that. And those conversations I think are the most are challenging to have, but really the most important ones to have as well.
Yeah, I agree that, I mean, certainly when I practice allyship, sometimes I have thought, well, you know, I don't want to speak for you, you know, and disempower by that way, you know, by speaking for someone. But I also recognize that sometimes the amount of unfortunate that, you know, vitriol that sometimes people experience, you know, it wouldn't be fair or right to expose them to all of that, because it's really difficult and disheartening to be put in the middle of those things. I don't think there's any completely easy answer. I think that's where we work together to figure that out, you know, what that looks like. Yeah,
and acknowledge that that's a whole extra job as well, because you've got your job of being a psychologist or whatever, and then you've got this whole extra job of actually you know, doing what you can to enable equality, diversity and inclusion, which I think acknowledging that however you're excluded or included, that's actually everybody's job. That should be part of our job plans, you know, that we're all engaged in that, because otherwise it's secret work that disadvantaged people do. It needs to be like not secret work that everybody is getting on with.
Yeah, and I'm talking about that this morning at work, actually. Yeah, I just
wanted to add, yeah, and I think we shouldn't be like, you know, ashamed of that, you know, this work that we're doing, because we're doing it to tackle real systematic problems. And if you think about health psychology as a discipline, and if you think about heavy lifting, health psychology is as a discipline, what I think is good, like in terms of equality, diversity, inclusion, it really focuses in right at the point of like prevention. So it's not, you know, it doesn't look at the symptom, but it looks at the cause and say, okay, how do we, you know, address these issues? And this is why I think, you know, why I align myself in this field of psychology, because it starts to look at, okay, it's not about treatment as such, but it's like, how do we stop people getting in the first place? And if we can focus on that, then we have a better chance. It's much more sustainable, much more economical, and then we have more chance of like people living their full potential, if you like. But I just, what do you guys think about that as a discipline of health psychology, the way it's aligned to this equality, diversity, inclusion? What do you guys feel about that?
I think for me, there's two elements here, with EDI applied to the health psychology workforce, for the staff who are supporting the health psychology profession. That could be aspiring health psychologists, trainee health psychologists, qualified health psychologists, but also health psychology applied to clients from diverse populations or considered diverse populations as well. And I think there's potential barriers and facilitators associated with both of those in terms of EDI. So I'm wondering if those are entirely two separate big pieces of work, and Lucie just mentioned there, in fact, on the nature of the scope of how big these activities actually are. So I think we're just kind of scratching the surface really, but I think at least we are trying to highlight those potential areas of things that we can do and work towards to exploring.
Funny thing is, my experience is completely different. You know, I work with people who have already got long-term illnesses, you know, and so where I see the EDI work, so my previous work, I was working in primary care, it came into the kind of work that I was doing was looking at, okay, who is accessing our service and who isn't, you know, and looking at the social ecological model around that, you know, what are the barriers for people to come through here and what can we do about that? Whereas now I work with people who are primarily Black, you know, a few Asian people as well. And what they experience a lot of is racism in healthcare, overt racism. And so therefore, a lot of what I'll do is acknowledge that and work with them around that and help them to self-advocate sometimes, where it's appropriate and they would like my help. So, I don't really work on the prevention side of things. I'm working more on the management side of things around illness. So I think there's wider applications than prevention, although I think that's quite a powerful area in its own right.
Yeah, and I think gosh, when you start to think about it, it balloons, doesn't it? It's like a broccoli stem. There's all of these different tiny bits and bigger bits, and that sort of, so there is the workforce, which is like where we kind of started from today, but then there is who we're representing. There's also the massive thing about what our research, the populations that our research is based on, and the populations who we're doing our research with and for. And there's some brilliant people working in critical health psychology who are asking those questions. And that's not necessarily mainstream enough either. We're not being challenged about, how many papers do we read where it says, the population was only these people because we couldn't recruit any of those people, and how much are we actually like trying to address those key exclusionary things. The other thing is, I've been learning loads recently from a student EDI committee in the place where I work, and they've been looking at all of those things. So admissions to being a student, to what's taught in the curriculum, and how we can, enhancing what people learn, who they are, what they're going to do in their future careers, so the patient groups that they're going to be working with. And those students, I think, and the staff working very closely with them are kind of opening my eyes definitely to all of the different ways that EDI should be running through what we're doing. And I feel like that's a huge learning thing as well, because you can just get really focused on one bit.
I think that's what you're saying there is really important. I think we can definitely, it can feel overwhelming to begin with when we look at it from a bigger perspective, but a lot of what we're doing is on the groundwork, and it's, I think real progress is a lot of different people doing all the different things that they're doing, but coordinating and maybe, communicating with each other about what they're doing and what they're learning, and so it doesn't feel quite so overwhelming.
Mm-hmm.
Yeah, definitely.
I think just the word overwhelming, I think, sticking out for me, because I'm just thinking about the different groups. If we're talking about diversity and what it stands for, there's so many different categories around diversity. You mentioned Black and South Asian groups such as ethnicity and race, but you've also got obviously gender, sexuality, if you're talking about the different sexuality groups. And I imagine that you could get people, and I mean by people within the health psychology workforce, and patients or service users who might represent multiple minority or diverse population groups, and if you are trying to work in practice, I can imagine that could be quite overwhelming to try and be mindful of all the perhaps potential diversity indicators, but obviously wanting to do your best and be able to support the person effectively. I can see how that could be potentially overwhelming, but at the same time perhaps it needs to be balanced with providing a space for people's voices to be heard if they're not otherwise.
I think, to be honest, I think I find it easier because I've been doing this for quite a long time, and you'd start to see patterns, in the kind of issues that people come across. So it doesn't surprise you so much anymore. B, I represent having multiple categories of marginalization. So some of those things, actually echo some of the same experiences that I've had, as a patient, as a person progressing through health psychology. So in some ways it's easier to see some of those things, but at the same time being reflective and recognizing that I don't over-identify with people and allowing them to bring what they have to our space. A lot of the real important thing from my perspective when working with individuals or groups is creating that safety and understanding and validating their experience, and being really mindful and open and almost, you know, enacting the kind of things that can go on, and it's an ongoing journey.
Mm-hmm.
No, thank you so much for sharing. I think, you know, there's a lot for the listeners who are taking this in to reflect on. I'm trying to, I suppose, explore, like, do we all, I think when we're talking about equality and diversity and inclusion, are we all, I suppose we all bring different perspectives to the table, right? Because not everyone's going to come at it from the same angle. So do you think sometimes that can be sort of like a barrier? Because, you know, my equality issues are going to be different to yours. Jan's, you're going to be different to me. So we're going to come at it from different perspectives. Do you think sometimes that could act as a barrier sometimes? Hence why a lot of people can't have that discussion. It's quite a deep question.
I wonder if what we're learning through all of this is that EDI is a thought process or a cognitive process, that actually it's about questioning your assumptions in every situation that you're in. It's not like well, we'll have this policy and that'll fix that, or we'll have more people who look like that or who are like that and that'll fix it. But it's that sort of it's mindfulness in your moment, isn't it? It's like, why am I here? Why is somebody else not here? You know, what am I doing to maintain structural inequalities here that I could do differently? How am I speaking about, how am I othering people? Because that I think that's a massive thing, you know, where we're all involved in groups, and, you know, the multiple diversities that we all inhabit. We're all occasionally in groups where the culture that is shared between other people, that we're excluded from it, and it's really a small way. You know, it's maybe you're not rich enough, maybe you're not thin, maybe you're not healthy, maybe you're not whatever, and they can be small things. But once you see the change, don't you, when we have patient and public involvement in groups, everybody talks much better to each other. Like, there's much less of that like, oh yeah, nudge nudge, wink wink, we all share the same weird understanding about something else. You know, it makes us more mindful and thoughtful about the way we're approaching stuff, and having that you know, imagining people's gaze on us from a makes us behave better, really. So if we can inhabit that a bit more, then it almost doesn't matter what the characteristics are that anybody brings with them, in a way. It's the fact that we're all open to the characteristics of everybody, no matter whether they're in the room or not. And I think that's the thing that I'm trying to live at the moment. You know, and I'm failing miserably, as we all do with everything that we try and live. But that I'm walking into a room, what am I doing, and how am I addressing myself, you know, to make things better, not worse.
I think I agree massively with that. To be honest, it's about not having a seat at the table, but also we know that, you know, from other, you know, say, and I'm learning from other fields and other experiences, that if you bring a group of diverse people together from different groups, then having those conversations about what our shared goals are is actually a really powerful thing. You know, really, really powerful thing. It is possible to move forward. And of course, there are times when we may not entirely get exactly what we want as individuals or as representatives of a specific group, but we can come to an agreement and understand each other better. And there will be some people who will want, say, for example, far more radical change, you know, overhaul the system and, you know, completely change everything upside down. Whereas there will be other people that will think, actually, you know, how can we make the existing structures better? And then, you know, some of it is about having those conversations about what is a viable way forward and where do we want to end up.
Yeah, I think I would definitely agree with that, Kiran. I'm just thinking in terms of, I think EDI should be central really to everything that we do. So Lucie mentioned that in terms of a research context earlier with participants and things, but I think we need to be mindful about, if we are looking at research and we're just looking at a particular social population, we should have that critical reflective awareness of perhaps, oh, maybe we're completely missing out a particular population. Maybe we're aware of that, at least we acknowledge that particular limitation going forward. I think, Kiran, you mentioned there in terms of spaces and conversations to talk about these different areas. I'm wondering whether we need to think about the most appropriate way of communicating with particular populations, because we may be using some form of communication, whether it's online environments, and because we have the assumption that we can always access the online environment, given most of us seem to be aligned in working in professional practice and higher education, where we've got access to the internet and all these other fantastic equipments, but some other populations don't have that access to that, and we could be inadvertently misleading a range of populations. So I think when we're thinking about communication, maybe there's our opening up these avenues for conversation is looking at different ways of reaching different populations or groups.
I think it needs to be tailored as well sometimes, you know, recognizing that you know, what might be work for one will not work for another, as you say. And blended learning approaches, for example, blended events, you know, could be quite a good way of accommodating. Or, you know, what I have seen in last year, for example, is that if there was an event, say a program that I went on to, they offered the opportunity for us to have a USB stick, you know, with internet access on it. You know, so yeah, it's all these thoughtful touches that can actually help us to take us to being more inclusive and better representative of the people that we aim to, you know, include in our profession and the people that we serve.
And some of that exclusion might be around us not asking the right questions, actually, or not communicating the right things as well. So, you know, that's also it's early. I think is that, you know, that idea that we ask a question, we find something out, and then we need to communicate it to people. You know, we need to, and I know we've all been doing this for a long time, but sometimes it's tokenistic and sometimes it's not, it doesn't work or whatever. But that idea, you know, that you actually get people engaged really early on so that they shape what the right questions are, and so then people then
talk about communication.
I did warn you.
That's all right. What's the word? What's the word? I should say to the audience, I go, Lucie did warn us actually at the beginning of the podcast. And I said, hey, look, at the end of the day, you know, we are real people. We have family, we have pets, we have, you know, our things that keep us, give us our sort of inner peace, if you like, which makes us human. So
stop now. We have huge dogs that make very loud noises. That's what
So we have special, I don't know if there's any bios for them, but we have special guests there. special guest appearances. Sorry, Lucie, you were saying,
I'm completely lost my train of thought, I have to say.
But the idea that you had about including people early in the process.
Yeah. And it's definitely, you know, people are voting with their feet sometimes. It's not always about, I mean, you know, let's use a health psychology framework. It's not always about opportunity. Sometimes it is about motivation, that we've asked the wrong questions and we're telling people the wrong things and we've turned them off, but we're too far down the line at that stage. To be inclusive, we needed to have begun it much earlier on.
Yeah, I think that's a really good point. I'm just thinking maybe there's that systemic barrier there, in the sense that maybe we don't question the question, or we using questions that we are so mainstream that we don't actually question it. And that could be said with different health psychology models that we use, it's different approaches. There could be some social norms within the profession that really drives how we're thinking, and we don't think to question that. But I think maybe there needs to be more reflective or embracing the more critical health perspectives where we're actually challenging how we're working in practice, particularly if we are utilising an approach which favours a particular population as opposed to others. So just opening those spaces and I think that we certainly within some institutions allowing space to actually challenge how things are done, but that may take further down the line or a particular challenge to actually address, and I imagine that will be quite tricky to administer. And for me that links to perhaps leadership styles and having someone people in powerful positions to be able to monitor that through or integrate that through, maybe, to the importance of critically evaluating how we're going about things.
No, I just wanted to, if you hear any sort of funny noises from me, and you might be seagulls and not dogs, I only live a few minutes away from the sea, so I was worried about that as well. I just wanted to touch up on, everything we're talking about, awareness raising, right? Awareness raising, being aware. Are we then talking about, this is from a psychological perspective, and you guys might be interested in answering this question around what does it mean, is around human consciousness. Is this what we're saying to ourselves, that we need to raise the levels of consciousness within psychologists, or so that we know what, so we can address or we can understand what equality, diversity, inclusion is? I know that's quite a deep question, but
I think different people are at different points when it comes to raising consciousness, and we also need to be aware that raising consciousness can be a painful thing. It can be painful, it can be uncomfortable, and we need to allow space for that, and space for people to ask questions, especially questions that they might feel are silly questions. But we also need to have spaces for people who are already engaged, to perhaps come in, and that's something that I'm hoping to host as a little drop-in space for people who are actually already engaged in anti-racism, for example, to share a bit about what's going well, what isn't, their hopes, and to connect. That's kind of, so I think we need to recognize and allow for room for both, where people are with their journey. If we look at the stages of change model, for example,
I was just thinking that all about people in the pre-contemplation, moving from contemplation to the other cycle, but it's exactly what I was thinking. People different stages, and we need to adapt our interventions according to that.
Absolutely.
And the thing I was thinking about, the intervention functions in the behaviour change wheel, actually, because I was thinking that we do need some awareness raising, but some people will be aware but currently not feel as though they've got things that they can do, so they'll have low self-efficacy potentially, and maybe we need to be doing some enablement. So I think that we need multi-pronged stuff, don't we? We need to be making rules that mean that we have to do things in certain orders, but we also need that sort of conscious raising, and all of those things about critically challenging yourself about what you're doing, because I think the big changes always happen. Think about the changing in smoking, for example, the legislation. I've heard it said, I don't know if there's any evidence for this, by the way, so I'm just saying it. I've heard it said that if they'd have brought in the ban in public places in the 1960s, that there just would have been mass civil disobedience over it, and it just wouldn't have worked. But it came on the back of years of campaigning, hearts and minds. And then it was, okay, we've really won everybody over, now let's legislate. And so I think there has to be this sort of hand in hand of legislation and awareness raising, and giving people the skills and ways that they can draw things to mind, as well as changing rules and regulations. And people's stories are just so powerful, I think. Discovering what people are going through, that's why films are so powerful, aren't they, compared to essays. So understanding what people are experiencing makes us want to change. We do largely have social capacity and social empathy in that way. We need to play on those things that we know are true.
Yeah, I'm just thinking in terms of, maybe we can think about our skills as health psychologists, and thinking about detailed needs assessments before we even get to the point of delivering intervention. So let's look at some exploratory work to actually, first of all, look at what do we mean by EDI, and what particular groups are we talking about here, because there's many of different groups if you talk about protected characteristics, but also getting people's insights into what the barriers and challenges actually are. So finding out that detailed exploratory work phase. You mentioned there in terms of smoking cessation there, Lucie, I do get a sense that this could be an ongoing process, hopefully not 30-40 years. If in the time, I think hopefully we can make some difference in the near future, but I do think having that knowledge and that awareness that can take some time to be able to embed EDI across health psychology, but at the same time providing and allowing spaces for exploratory work, I think could be a useful starting point. I'm also wondering about awareness and how do we bring that into practice? So how do we cultivate that?
I think I think funny enough, we were talking about agreeing and disagreeing earlier. I think I disagree that we need the needs assessment to happen all at the start. I think there's definitely room for a bit of an ongoing assessment of where we are, as well as doing, you know, and I think we are kind of doing some things that are, you know, that are relatively low key, you know, and we can learn also. We don't necessarily just have to think about the evidence within our area. We can also learn from what others are doing that have actually already worked. So, you know, there's those kind of things. I think they do go hand in hand. And about intervention, I would say that maybe there is room for co-producing intervention rather than doing two. I think that could be quite important to meet people where they are. And also, don't forget, we all, you know, one of the things that we are contending with at the moment, I don't know how much this is true of health psychologists, but we do live in a slightly polarized society at the minute, you know, and I don't know if that is reflected in our profession, or, you know, we have certain people perhaps more vocal than others. So, you know, thinking about how we can engage as many people as possible. Admittedly, we may not reach everyone, but we can try and to meet people where they are.
It's tricky, isn't it? 'Cause if we are dealing with so many different populations, where do we start?
I think possibly like one of the ways that we can do, one of the things that I've learned over time about doing EDI work, because I've worked with people who are like South Asian around diabetes. I've worked with LGBT plus adults at the same time around healthcare access, and people with learning disabilities at the same time as well. I've realized that if you look at some of the ways that, you know, if you actually do address some of those areas, one or two areas at the one end, if you like, then it actually makes it makes it easier to tackle other things. So it's not that you're starting from scratch. You're perhaps looking at a few different areas which you can make an improvement, and that has downstream effects on other things. So it's just thinking about that, and also getting input from, you know, the wider health psychology profession, if we can, about what they would like us to look at as well. You know, that requires some engagement too.
Yeah, and I think the in answer to where do we start, really, it has to be with ourselves. So I think that it's looking around our own sphere of influence, if you like, and asking what we're actually doing. You know, we're in the position that we're in. We've got power. You know, we're all very privileged in many ways because of the profession that we're engaged in and our levels of education, etc. So what can we do with that privilege that we can actually do tomorrow? And that's the starting point, isn't it? And then it's, you know, can I devote more of my time to that? Can I devote more of my energy, you know, resource, all those kinds of resource, and then working from yourself outwards, I suppose, because we do have, like, I guess, power, surprising amounts of power over surprising numbers of things once we start really thinking about it. So yeah, I think beginning with ourselves is the main place to start.
That is an excellent point where we can press pause on our podcast. We're coming to the end. I just wanted to give you one final opportunity to share any last thoughts before we say goodbye.
I feel like I want to say something really profound, Jolel, yes, but I'm not sure that I can. I think just that it's so it's great that we're having these conversations and that we can get involved in them, and great that, you know, we're open to learning about stuff. I mean, that's what we're all, you know, lifelong learners, they say, don't they? In higher education, we're all lifelong learners. And I think we, you know, we've got to find a way to do that, and, you know, making personal commitments to doing those things, and acting on what we can act on when we can.
I'd love to see us bring examples of what we're doing already, and what it's bringing. That'd be really interesting. I think we could learn a lot from each other on the way.
Yeah, I agree. I think just sometimes it's really useful to get actual evidence of things which are working well, and actually hearing. For me, I'm quite motivated to hear from people that we don't tend to hear from. So perhaps some really small minority populations that we're perhaps missing. I do think within health psychology, and indeed psychology more generally, we need to be mindful of our power and our privilege, and it's hard, really tricky to do, but take a step out of yourselves, reflect and engage that, right, whether it's reflective or reflexive practice, actually recognize that what you may be thinking or what we truly believe in might not be representative of the group. So it's just taking that step, and I think that's an uncomfortable step for some people to have their views potentially challenged by an unknown population or hidden minority population. But yeah, I agree with Lucie and Kiran there. It's learning outcomes, it's a learning journey, and I think I do think that there is that element of being respectful, being compassionate around humans and how we're all different, and I think it comes back to that and the importance of EDI.
Yes, no, thank you so much to our guests, Lucie and Kiran, and co-host Jan. I think for the listeners, if they want to catch the full podcast, that's going to be available on YouTube and wherever you listen to your podcast. If you just search for Equality, Diversity, Inclusion, Health Psychology podcast, then you should be able to find it. Just wanted to make the final point around what we discussed today, which is what do we mean by equality, diversity, inclusion. You can see that it's not an easy piece of work. It's very complex, but it is important because at the end of the day, it affects us all. So if you want to work with us or learn more, come and let us know. And I'm sure we will see you on our next episode.
Thank you, Jolel.
Thank you very much.
Thank you.
Thanks, everyone.